Hello, we are here to talk about a proposal for a new program geared towards women's health in the WeCare system. We want to institute a program that focuses on treating and preventing STIs in teenagers. The program will include educating patients on STIs. This includes education on what STIs are, risk factors, signs and symptoms, how they are transmitted, as well as ways to prevent STIs. The program will also offer screenings for STIs in sexually active patients and encourage vaccinations against HPV, which is currently recommended for patients starting at the age of 9. This program will be instituted in the WeCare Pediatric Clinic with a focus on the adolescent patients. The STI treatment and prevention services will be available to all patients in the clinic who desire the services. While STI prevention is important for both genders, STI prevention is vital to women's health because of the increased prevalence of STIs in females over males. Additionally, STI prevention is important in all age groups. However, we feel it is important to institute our program in the WeCare Pediatric Clinic and target adolescents because of the high rates of STI in this age group, as well as being able to target females before they engage in sexual intercourse. According to the Centers for Disease Control, the highest rates of reported chlamydia infections were those among age 15 through 19 and 20 to 24. Gonorrhea rates were also highest in those aged 15 through 19. Lastly, HPV rates are high in adolescents. STIs can cause many issues in females, including infertility. Educating young girls on how to prevent the spread of STIs and treating those who present with an STI can go a long way in decreasing the STI rates in adolescents. To provide these services, we would have a nurse practitioner and a clinical pharmacist. The nurse practitioner will be involved in the diagnosis and treatment of STIs, as well as being able to administer the HPV vaccine for those who have not already been immunized. The clinical pharmacist will be involved in educating patients as well as being able to offer appropriate therapy recommendations for individual patients diagnosed with an STI if standard treatment is not appropriate. Sample of the treatment algorithm that will be implemented includes chlamydia that will be tested using a urine sample or a sample collected from the cervix. First-line treatment is azithromycin 1 gram by mouth for 1 dose. Gonorrhea will be tested using either a urine, endocervical, or vaginal specimen and can be treated using ceftriaxone 250 milligrams intramuscular injection for 1 dose. Syphilis can be determined using a blood test, and treatment includes penicillin G 2.4 million units intramuscular for 1 injection. For patients who cannot use these options, the clinical pharmacist would be available to provide alternative therapies. Vaccinations against HPV should be initiated in patients starting at the age of 9 or to patients who are older and have not been previously vaccinated. The immunization consists of a 3-dose series. The second dose is given 1 to 2 months after the first dose, and the final dose is given 6 months after the first dose. It should be stressed that completing the vaccination series before initiating sexual activity provides the best protection and that it will not treat or cure a current infection. Lastly, despite vaccinations, it is important for patients to understand that vaccine does not prevent against all forms of HPV, so cervical cancer screening should begin at the age of 21. The most important part of our program will be to educate patients to prevent and spread of STDs by promoting safe sex practices. The education will include information about abstinence, oral contraceptives, barrier methods, when to get screened, and the importance of staying up to date with the vaccinations. We hope you liked our proposal. Thank you.